today, and welcome to the Watani Ophthalmology Summit, the 10th edition. Today we will talk about the biometry or IOL power calculation. We will not be able to cover all the topics of this biometry course, but we will cover the most important or difficult parts in the biometry. At first, I'd like to introduce myself. I'm Dr. Sherine Shafik, Professor of Ophthalmology at Shams University and a consultant in Al Watani Eye Hospital. I will take you in a journey between the old and the new biometric formulas. First, I'd like you to know the history. In 1949, really the first one implanted first IOL in a blind eye with a refractive error minus 20 diopter. In 1980s, the standard power of IOL plus 19 diopter implanted with a fixed IOL power. This leave 5% with refractive error more than 5 diopters and gave anisometropia and significant anidoconia. So they started to think how to get an accurate IOL power calculation or more power, predicted IOL power calculation. This was through accurate estimation of corneal power, axial lens, effective lens position, and formulas. With the formulas now, they started with a regression formula, and the working principle of this is to generate a mean value and incorporate a correction to deviations from the mean value. It has an advantage of it based on actual measurement, but it only works for the data set from which it is derived. For example, if you get an axial lens from the ultrasound, you will not be able to apply it for optical coherency interferometry unless you add a correction. Example for this regression formula is the first generation of SRK1 with a famous formula and Benhorst formula, and the second generation with SRK2 with a modified A constant. But actually, these formulas are obsolete. Then for the modern formula, it is based upon Fyodorov equation, and this is a difficult equation. The only variable which cannot be measured preoperatively is the effective lens position. So what is the effective lens position? Effective lens position is a distance from the anterior surface of the cornea to the lens plane. The effective lens position may be back calculated as the effective anterior chamber depth. As you can see here, the effective lens position, if the IOL more anterior, excuse me, I will get the pointer. Please. Point. Thank you. The effective lens position is a distance from the anterior corneal surface to the lens plane. If it is more anterior, you will get a lower IOL power, and if you get it more posterior, you will have a higher IOL power. The third generation involving 3 formulas, Hofer Q, Holiday 1, and the SRKT. All of them, the parameters used to the prediction of the effective lens position was the axial lens and the corneal power. The Hofer Q work best for the short eyes less than 22 millimeter. The average lens from 22 to 24.5, you have to get the average of the 3 formulas. If you have an axial lens from 24 to 26, Holiday 1 work best. For more than 26 millimeter, it's SRKT. This, if you don't have in your machine any 4th generation or online, so you will relate on 3rd generations. And these formulas, each one of them to get this effective lens position relies on a certain constant. The Hofer Q on personalized anterior chamber depth, the Holiday on surgeon factor, and SRKT on A constant. So what is the A constant? A constant is a number highly variable depending upon IOL-dependent factor like the type, material, position, and optical design. For example, if you have a posterior chamber IOL in bag, the A constant with 118. If it is anterior, it will be 115. It varies with a ratio 1:1 with the IOL power. And another surgeon factor, which is technique of the incision and the placement of the incision. And what is a surgeon factor? Surgeon factor is a number representing the distance from the post-operative anterior iris plane to the effective optical plane of the IOL. And what about the personalized anterior chamber depth? It is a complicated formula, but Hofer put into consideration constant added to the anterior chamber depth, factor tied to the IOL style, factor tied to the axial length, another to the corneal curvature, and factor tied to the extremely long and short eyes. And then we go for the fourth generation. In the fourth generation, first we have the Haigis formula. And they tried to get more accurate effective lens positions through increasing the variables they are using. So Haigis used a constant of 3 constant, A0, like that of the A constant and the surgeon factor, and then A1 tied to the anterior chamber depth, and A2 tied to the axial length. Haigis used 3 parameters for the detection. Beside the axial length and the corneal power, they are using the measured preoperative anterior chamber depth. It is recommended for all types of eyes. But if in these cases, if we have a problem in the anterior chamber measurement preoperatively, like this with a subluxated lens or phakic IOL, don't use Haigis formula. It is best in the long eyes, like 29.7, and it will get better results if we use the Wang-Koch formula for adjusting axial length more than 25.2 millimeter. This formula applied to the third generation's formula and also to the Haigis for the fourth generation. Its purpose is to shift the refractive outcome in long eyes from hyperopic to myopic. And then for the fourth generation, we have Holiday 2. And the Holiday 2 increased the parameters used for the effective lens position prediction to 7. Beside the axial lens, corneal power, anterior chamber depth, he add lens thickness, age, white, and preoperative refraction data. It is good for short and long eyes. For example, here, 21.3 Holiday give good results. And then for Barrett is a relationship between the E constant and what is called lens factor. So what is the lens factor to determine anterior chamber depth? It is a number representing distance between the iris, if this is the iris, and the second principal plane of the IOL, whatever the geometry of the IOL. Is it convex plano, plano-convex, or biconvex? And he thought that the second principal plane does not change much with the configuration or the geometry of the IOL. That's why this formula is very good, whatever the type of the IOL, high power or low power IOL. And it depends upon 5 parameters. Besides the axial length and the corneal power, use the anterior chamber depth, lens thickness, and white. And it is recommended for all types of, all ranges of the axial length. This is an example of the high myope, and as you can see here, Haigis and Barrett, the fourth generation, give a good results. Holiday 2, fourth generation, but it is out of the range of the Haigis and Barrett. For the average axial length, as you can see here, all the fourth generation, Holiday 2, Haigis, Barrett, give comparable results or even the same results. Holiday 1, even the third generation, give the same results. And now for ray tracing, we have Olsen, and Olsen used a C constant, which is a ratio represent the preoperative thickness of the crystalline lens by which the IOL will locate itself, how the IOL will centralize inside the capsular bag. And he put into consideration the anterior chamber depth and lens thickness. Olsen present in lens star, not in IOL master. All the previous formulas present in IOL master 500 and 700. The fifth generation of Hofer H, Hofer replaced the axial lens Dr. Holiday used by the gender and race, but it needs more optimization and evaluation. Now for the new era of artificial intelligence. I will not talk about all the formulas in the artificial intelligence, but I will talk about the important ones like the HEAL RBF. And the HEAL RBF is a method, it's not a formula. Using pattern recognition, it's a very accurate 90% within plus or minus 0.5 diopter. And now there is HEAL RBF 2 and 3 released on December 2020. And the calculation optimized adding lens thickness, white, CCT, and gender. Now they are using 8 variables. And the Kane formula with a theoretical optics, artificial intelligence with a theoretical optics. This is the site of the Kane formula. Actually, a study on 2020, amazing study on 10,000 eyes. The Kane formula compared with the other online calculator of artificial intelligence like the HEAL RBF2 and the fourth generations and the third generations and the Kane formula almost give was the most accurate formula for all ranges of axial length. This is a display of the Kane formula. So the take-home message, please, SRK1 and SRK2 of the first and second generation are obsolete. Don't use it. And now, if you, in your practice, you don't have any formulas except the third generation, the Holiday 1, Hofer Q, and the SRKT, go for Hofer Q in short eyes and the Holiday 2 and the Holiday 1 in short eyes. For SRKT, go for high axial length more than 26. But please add the 1 Koch axial length adjustment. If you have a fourth generation or online calculator, please don't use the third generation and go for the rest. The fourth generation, the Haggis will work fine for all range of axial lengths, but please add the 1 Koch axial length adjustment. Holiday 2, very good in short axial length. If you would like to use it for long axial length, add the adjustment. Olsen, Barrett, HEAL RBF, and the Kane work excellent on all ranges of the axial length. And thank you.